and its contribution to sustainable healthcare. Really excited to be presenting this today, a joint presentation between Canada Health Infoway and the Center for Sustainable Health Systems at the University of Toronto. I'm Simon Higgins. I'm going to be moderating this session, and we've got three excellent presenters with some expertise in the field to share with you throughout the session. Next slide, Minna. This presentation this webinar is done in collaboration with our BE Collaboration Network. So hi to all the folks on the BE Collaboration Network, and for those of you that are interested in joining, by all means get in touch with us. You can see Nancy's email there to do so. This is a group that sees webinars on a regular basis, sharing some of the results from Infoway's performance analytics and evaluation activities. So for the presentation today, we've got three great speakers to go through, and then we'll leave some good time for the QA session. So first of all, we'll have Bobby Georgiou. Bobby is the manager for trending and performance at Canada Health Infoway, part of the performance analytics team. And he's going to be talking a little bit about telehealth. And this is really the kind of care that's been delivered to Canadians in rural and remote communities for decades now in Canada. And it's really been an area that Canada has been a leader, and there's been a lot of value generated thus far from that work. We'll turn it over then to Nicole Sims. Nicole is the managing director for the Center for Sustainable Health Systems at the University of Toronto, and she's going to make the case for environmentally sustainable health systems, and we'll speak a bit about that and speak a bit about the important role of virtual care in that. Then we'll pass it over to Waldo Beausejour, who's an analyst with the performance analytics team at Canada Health Infoway. He's going to be talking a bit about some of this current experience with virtual care, some of the utilization, and some of the current environmental benefits we're seeing, and some of the projections we have for that. And then finally, we'll leave a good chunk of time for QA at the end. You'll note that your mics and video have been muted for this call, so we'll be using the QA feature. I really encourage you to get in there and submit those questions early. I will be throughout the session monitoring the questions and trying to consolidate and make sure we get the most important and popular questions to the top of the pile. So by all means, ask those questions all along the way, and then I will share them with the presenters when the time comes. So thanks for joining me. Without further ado, I will pass it over to Bobby.
Thank you, Simon, and hello, everybody. I wanted to just speak a little bit about virtual care and some of the background work that has gone into where we are today across Canada. First of all, a definition, and you're likely to have heard the term virtual care in many different contexts, and probably have it applied to many different technologies. We're using most recently the Digital Health Canada definition of virtual care, which is very broad, and it needs to be broad in order to accommodate the constantly changing landscape and technology applications that go into virtual care. But anything from video visits, telehealth, nurse call lines, telehome care, SMS or email messaging, and even telephone consultations can all fall within that broad definition. As far as our discussion today, we're not going to touch too much on telephone consultations. It's obviously a mature technology, and we haven't gone into too much depth on that front. However, we are going to speak about telehealth and about virtual visits in a primary care context. For a bit of background, Infoway has invested nearly $77 million in our telehealth program over the years, an additional $45 million into telehome care programs. These are joint programs with all the provinces and territories across our country. Most recently, we've established a rapid response virtual care fund. This is to address the COVID crisis, and it was a program that went from inception to deployment in 45 days, which is quite remarkable, and a testament to our partners to be able to roll this out so quickly. So next slide. So the area that I wanted to focus on is telehealth, and to contrast that with our current work in virtual care. Um, Canada has been a leader for much of the past decade, and even before that, in delivering telehealth programs to rural and remote communities. And the focus has been on providing care to those rural, remote communities, especially in access to specialist care. The programs have focused on two types of technologies mainly, which is live video conferencing, and also store and forward solutions where images or videos are transmitted for things like dermatology, or certain radiology applications. The distinction in our analysis is when we talk about virtual care, we're going to refer to primary care delivered by video or messaging, and talking about telehealth, that's more the specialist care delivered to rural and remote communities, as we've done for the past decade. So next slide. What I wanted to show you here is really that telehealth has grown consistently over the past decade, and even as far back as 2010, we were seen as being leaders across the world in video conferencing, and providing care to remote communities. Next slide. In 2011, we did a benchmark study, a pan-Canadian study in partnership with Praxis and Gartner, which really looked at the benefits of telehealth. And despite it being close to a decade old, it's still very relevant today. And some of the projections made in that study are actually have proven to be reality today. And that report highlighted benefits like improved access to care for Canadians in rural communities, avoided travel for both patients and clinicians, and reduced wait times to obtain specialty care. Next slide, please. So one of the benefits that really piqued our interest, next, was regarding avoided travel, and projecting the current activity in telehealth across the country. We estimate that 355 million kilometers in travel have been avoided through the use of telehealth. Next. What that represents is 97,000 metric tons of annual CO2 emission savings. Another way to put that is avoided 42 million liters of gas through that avoided travel through telehealth. So what we wanted to do was explore that a little bit more, especially given the increased awareness around the risk of climate change. This is quite a big deal, and we wanted to get into this topic a little bit further, and to also see if we can apply a similar type of analysis to primary care consultations and what that would represent. Before we get to that, I wanted to pass the mic to my colleague Nicole from the Center for Sustainable Health Systems, who will discuss healthcare sustainability in more detail, and how that may apply to virtual care. So over to you, Nicole.
Thanks, Bobby. Hi, everyone. So I am with the Center for Sustainable Health Systems. We are housed at the Institute of Health Policy Management and Evaluation within the Dalla Lana School of Public Health at the University of Toronto. And our focus as a center is on addressing environmental sustainability in the healthcare sector, and particularly in the provision of care. So how can we make the delivery of care more environmentally sustainable? And I'm going to talk to you a little bit about why it's really important for us to be focused on that, and the role that virtual care might be able to play in helping us make this shift towards more sustainable health systems. Next, please. So here are the two things I'm going to be focused on: making the case for environmentally sustainable health systems, and then talking about virtual care as a key component of those health systems. Next, please. And next. So starting things off on a cheerful note, we all know that we're already feeling the impacts of climate change, and these are expected to intensify dramatically in the very, very near future unless we undertake dramatic action to limit our emissions. Next, please. So most of you have probably seen a graph like this before. We know that rising CO2 levels have been associated with an increase in temperature, and you can see here that this chart goes to 2020. And so we want to think about what happens after that. We're here now, what's next? So next slide, please. So here is an image from the Intergovernmental Panel on Climate Change, looking at different scenarios, and these scenarios basically depend on what we do today. So we are on course to increase temperature by 1.5 degrees. If we make some significant changes in our activity, and I mean very significant changes that would result in basically a 45% reduction from 2010 levels of CO2, we are going to be able to avert an increase, hopefully above 1.5 degrees centigrade. If we do not do that, then all of the impacts that we know to be associated with climate change, increased severe weather, including droughts, damage to ecosystems, and the human health impacts that are associated with those environmental changes, those are all going to be dramatically intensified. Next, please. And the extent to which we will experience those different effects, and you can see them illustrated here: unique and threatened ecosystems, extreme weather events. The extent to which we experience those is really going to depend on where we fall in that scenario. In the worst case scenario, those effects are going to be catastrophic. In the better case scenario, they will hopefully be manageable. Next, please. So we are, as I said, and as you know, already experiencing many of the impacts associated with climate change around the world and here in Canada. And you can see a lot of different environmental impacts shown here in different parts of the country: rising sea levels, ecosystem changes, including new invasive species. I want to pay attention, though, to the human health issues that are associated with climate change. Next, please. So there has been a lot of talk about the threat that climate change poses to human health. So the Lancet Commission on Health and Climate Change described climate change as the biggest global health threat of the 21st century. And that language has since been modified a little bit to tackling climate change could be the greatest global health opportunity of the 21st century. In the necessity to adapt to climate change, we have the opportunity to remake our systems, including our health systems, into systems that not only address climate change, but that also improve our well-being in many other ways. Next, please. So I just want to take a quick look at some of the health impacts that are associated with climate change. So you can see here the direct impacts, those kinds of extreme weather events associated with climate change, and how they interact with indirect impacts. And these are indirect impacts of climate change, and they're also things that happen as a result of other forms of environmental degradation. So we do need to be mindful of other kinds of pollution that are happening: water pollution, air pollution, etc. And then these things interact with social dynamics like age and gender, health status, socioeconomic status, social capital, public health infrastructure, mobility, to produce an array of health impacts. So these health impacts are experienced differently by different segments of the population. And we want to try to ensure that across the board, we see a mitigation of the impacts associated with climate change, both today and in the future. Next, please. So we definitely have seen within the health sector a discussion on how healthcare needs to respond to climate change. So the healthcare system needs to be resilient. It needs to adapt to the effects of climate change. But we are also seeing a focus on the extent to which healthcare is actually contributing to the problem. And so this is a paradox that the sector that is tasked with maintaining and improving health is actually contributing to something that threatens it, is contributing to climate change. So we need to think about, in addition to responding to climate change, what can we do to help lessen our contributions to it? Next, please. So this is not an insignificant contribution that the health sector is making. So Healthcare Without Harm cites that if the global healthcare sector were a country, it would be the 5th largest emitter on the planet. So there are significant carbon emissions coming from the healthcare sector. Next, please. You might think that those emissions are the result of the very large healthcare facilities that we have in many parts of the world. But actually, the NHS has been doing work on environmental sustainability and health for a number of years, and they've mapped out the origin of the health sector's carbon emissions in England. And they actually find that building energy use is not a significant contributor to the health system's carbon emissions. The most significant contributor is the procurement of those things that we need to deliver care. So drugs, devices. So it's really important to think not just about improving the efficiency of our facilities, but actually changing how we deliver care itself in order to achieve more sustainability in our health systems. Next, please. So we see the NHS really pushing forward on this. They have taken this issue very seriously, and they have come up with a national plan to reach net zero carbon emissions in the health system by 2050. And this is a very ambitious plan. They're still working out the details of it, but the point is they have this coordinated effort. Next, please. And it's good that they do, because if I can get a click, please, Minna. They are pretty up there when it comes to per capita healthcare sector greenhouse gas emissions. And can I get another click there, please? We are actually above them when it comes to per capita healthcare sector greenhouse gas emissions. So they've got this coordinated national plan. We have no such effort. We do have a number of efforts being undertaken by different groups across the country. But again, these haven't been on the kind of scale that we've seen in England and that we really need to see here in Canada, given the emission rates that you see here. Next, please. So again, this is not just about addressing our facilities. It's about creating future health services that are built on sustainable and low carbon systems and work models. What might those look like? Next, please. So the Centre for Sustainable Healthcare is our sister organization in the UK, and they've been involved with much of this work. And so they articulate the main objective as reducing carbon without reducing health. This is the key to environmentally sustainable health systems. And there are two things that we can do to get there. We can reduce our activity, or we can keep our activity as is, but we can reduce its carbon intensity. And there are a number of different ways that we can do this. And virtual care really gets at both of these two things. Next, please. So now I want to talk about that. Where does virtual care fit into this needed shift to more sustainable health systems? Next, please. And next. Okay, so I want to just talk quickly about some of the arguments that have been made in favor of virtual care as green care. Can I get a click, please? So with respect to travel, as Bobby has mentioned, if I can get a click, we do see reduced patient, caregiver, and staff travel associated with virtual care, and this results in reduced transportation-related emissions. Next, please. There is the possibility that with the increased uptake of virtual care, there will be less of a need to power the physical infrastructure of healthcare facilities or even build new facilities. So this would result in reduced environmental impacts of creating and maintaining these facilities. Next, please. Then we have the health system itself. Next. So it has been argued that virtual care really empowers patients and allows them to have a driving role in managing their health. And this has the potential to improve health outcomes and to prevent the development of health conditions, thereby lessening the need for healthcare and lessening those associated carbon emissions. So if I can get another click, please. We can see here how these first two items with respect to travel and physical infrastructure, they are reducing carbon intensity of activity. And then all of them, and this third one, the health system, all of them have the potential to reduce activity as a whole, insofar as with the first two, if they reduce carbon intensity, there's a kind of feedback effect where health issues associated with climate change are lessened, which means that further care is not as required. And then the health system helps to lessen or having conditions improved or prevented as a result of access to care can reduce the need for care as people have better health outcomes. Next, please. So here I just want to kind of clarify what I just talked about this kind of positive feedback loop that we're seeing. So we have these different things happening, these different reductions in travel, in operational activities, in negative health outcomes, producing a decrease in healthcare related carbon emissions. And can I just get kind of a series of clicks as I go along, please? So first we see this mitigation of climate change impacts. Right? So we have decreased healthcare related carbon emissions, then we see a mitigation of climate change impacts. And because the impacts of climate change are lessened, we then start to see a mitigation of associated chronic and acute health impacts. So all of those impacts that I talked about before as being associated with the direct and indirect effects of climate change, if we mitigate climate change, we're mitigating those chronic and acute impacts. Click, please. Then we've got, again, this lessened need for healthcare, and another click, and another click. We have decreased healthcare related carbon emissions. So it's a really positive feedback loop where in reducing the carbon intensity of activities, we're ultimately reducing activities. Next, please. So we can't just think about benefits, right? There are costs associated with green care when it comes to the environment. And the key environmental cost is in regards to the physical infrastructure that is required. So Bobby talked about the distinction between telehealth and virtual care. With both of those methods of care delivery, you need a facility with a large monitor for telehealth. For virtual care, there are other kinds of configurations, but people need some kinds of electronic equipment to consult with their care providers. And on the other end of it, care providers need to have access to technology as well to deliver care. So there are emissions associated with the life cycle of these technologies during the manufacturing phase, the distribution, the operation, and the end of life phase for these technologies. And we need to be mindful of all of these. Next, please. So it might not be new to you to hear that telemedicine is green. This is an idea that's been discussed for a long time. However, there was a point at which there were calls for more evidence to substantiate this claim. Really a need to better understand the balance point between the environmental costs and benefits of telehealth and virtual care. Next, please. So how do we do that? How do we actually weigh these costs and benefits? So there are three questions that I want to sort of briefly get at before I turn things over to Waldo. First, can I get a click, please? What factors contribute most to carbon and other emissions in virtual versus in-person care? And I am using virtual here to encompass telehealth and virtual care. I should just clarify that, because the literature upon which I am drawing, there are studies that refer to various types of technology, but we can still make some kinds of overarching claims about virtual care writ large. But when we start to think about this, how do we quantify these different factors? What data do we use? What sources do we consult? What are the system boundaries? And I'll explain what I mean by that in a second. And is there a specific threshold at which virtual care becomes a more environmentally sustainable mode of healthcare delivery? Is it initially more sustainable? Do we have to get to a certain point? How do we make sense of this? So next, please. So this is what I mean when I say, how do we define the system boundaries? So when we think about information and communication technologies, again, we have these different phases of the life cycle. Do we think about the inputs and outputs involved in manufacturing, which could include even the extraction of the raw materials needed to make this technology? Do we think about the emissions associated with distributing these products? Do we think about the emissions associated with their use? And what about when we dispose of them, when they've reached their end of life? So if I can get a click, I just want to mention that most of the studies that are out there looking at this do focus on the carbon emissions associated with the use of this technology. And that may be something that's up for debate. Next, please. So I mentioned that there is literature on this topic. I've cited a few studies for you here. The first one is actually from UHN, University Health Network in Toronto. And so these studies that are out there look at different kinds of care. Again, they look at different modalities. Some of them are looking at car travel. Some of them involve air travel. This last one here, the Wetton paper, involves air travel. And then in thinking about measuring the costs of the ICT involved, some of them are measuring the emissions associated with telehealth, some of them with smartphones, some of them with the telephone. And then some of them still do include some travel in the CO2 associated with virtual care when it is telehealth, and there is some travel involved to a telehealth facility. But the point that I want you to take away is that in all of these studies, there is a CO2 savings that is very significant in virtual care as compared to in-person care. Next, please. So here's one of the studies that I mentioned, the Holmner study. And you can see here that the authors have looked at several different forms of ICT in their analysis. And the conclusion that they came to is that telerehabilitation is carbon cost effective once there is a need for the patient to travel at least 3.6 kilometers by car for a 1-hour appointment. That is not a very long distance. And I just want to call your attention to something on this slide towards the top. It says modification of data depending on technological setup used. And if I can get the next slide, please. That is the next question that I want to get at. Click, please. So what influence do setups and different use scenarios have on net emissions? Click, please. So these might change over time as vehicles become more fuel efficient, or we have a higher proportion of electric vehicles in Canada's fleet of vehicles. The equation might start to change. As ICT becomes has better environmental performance, we may need to rework some calculations. And let me show you this example of ICT versus vehicle greenhouse gas emissions as an example of the technological setup. So next, please. Just a quick point to make here. In Canada, we still primarily have fossil fuel burning cars. So there are few electric vehicles in our proportion of cars in Canada, right? So averting the use of cars in Canada, because most of them are burning fossil fuels, is probably a good thing. When it comes to ICT, which uses energy, we can see in Canada that the percentage of total electricity from non-emitting sources is high. It's 82% in Canada compared to other places. That makes Canada a potentially good place to have technology that draws on electricity instead of technology that draws on oil to help facilitate healthcare. And next slide. Just to clarify that we do need to be attentive to differences across the country. So some provinces like Ontario, which is highlighted with the little red arrows, draws a larger proportion of its energy from non-emitting sources, as opposed to a province like Nova Scotia, which does draw its energy from emitting sources primarily. So we need to take these factors into account. Next, please. And then this final question, how do we take these factors into account to move forward? And we are starting to see this great uptake in virtual care as a result of COVID, and we may see this sustaining itself post-COVID. How do we maximize the sustainability of virtual care? Next, please. How can we optimize it? So this is really my last substantive slide. Another click, please. So I want to think about these different sort of areas that make up the provision of virtual care. We have broader infrastructure that we are sort of plugging into. And some of this can be internal, your hospital's power system, for example, but a lot of it is external to our care facilities. So we're talking about that power grid. We're talking about the power that's used to power data centers and servers, right? Next, can I get a click, please? Then we have the system that is built, the telehealth or virtual care system. What is the particular arrangement or permutation that this comes in? So do we have telehealth facilities where people are having to drive to a location, or are people able to access their care provider from home via their smartphone, right? What kind of system do we build? Click, please. We then have another click, the technology that populates that system, those smartphones, those monitors. And then another click, and another click. We have the users. So at all of these different levels, we can advocate for or make decisions that can improve the sustainability of the health system. At the infrastructural level, we can advocate that our institutions produce or procure more renewable energy. We can also make those kinds of demands at the sort of provincial or national level. We can look at the kind of energy that data centers are run on, and these are all things that we can take into account. At the system level, in as much as possible, where we can have systems where users connect directly to their care providers, again, we need to be mindful of privacy concerns, we need to be mindful of the digital divide, but this is less carbon emitting than having to go to a telehealth facility. With technology, we can have environmental sustainability be part of the procurement process so that more sustainable products are sourced. And then with respect to users themselves, we can try to ensure that the most people possible have access to virtual care so that we can really maximize this positive feedback effect where they're getting more care. We're seeing a decrease in the effects of climate change on health, which therefore lessens the need for further care. Next slide. So I will just conclude, and I'm slightly over time and I apologize, by saying that environmental benefits are quite clearly an additional reason to implement and support telemedicine services. So we would never say this is the only reason, but if there are other compelling reasons for which to make a large shift to virtual care, environmental benefits should certainly be considered among them. And this is actually something that we think might resonate a lot with patients. Environmental sustainability is something that patients care about. A lot of patients care about, and knowing that virtual care has the potential to be more environmentally sustainable may help to make it more compelling to people who might otherwise be undecided. So thank you.
Hi, everyone. Hi, everyone. Hi, everyone. My name is Waldo, and thanks for joining this webinar today. I want to start by saying that nowadays we tend to live in a virtual world. Shopping, banking, schooling, you name it, they are all done online. And this webinar today is a concrete example of our virtual world. By attending this conference virtually, you and I are contributing to reducing CO2 emissions. So kudos to Infoway and U of T for organizing this webinar. Now, for healthcare provision, some Canadians visit their doctor or place of care virtually. So does virtual care contribute to lowering the carbon footprint of healthcare industry in Canada? I think the answer is arguably a big yes. But by how much does it contribute to? Answering this question constitutes the main point of my talking today. My presentation is divided into two sections. So in the first section, I'll present the findings of our analysis by emphasizing the environmental benefits of virtual care. In the second section, I will walk you through the current virtual care landscape during the ongoing COVID-19 pandemic. And in terms of objectives of our analysis, the main objective pursued by our analysis was to generate estimates for the reduction in CO2 emissions associated with virtual care services utilization in 2019. And to generate these estimates, our analysis used data from the 2019 InfoWays Access Health Survey conducted on a representative sample of more than 4,000 Canadians across provinces and territories. Next, please. From an economic standpoint, virtual care can be regarded as a commodity, and like any other commodity, it has demand and supply sides. On the demand side, there are three things to highlight. One is there is a huge appetite for virtual care. For example, 63% of Canadians want to consult with their care providers through email. Two is the consumption of virtual care services. For example, 3% of Canadians had used online video consultation in 2018. And three is patient experience. And for the experience, the majority of patients reported that virtual care visits were equivalent to in-person care. Next, please. On the supply side, we have 27,000 physicians and 40,000 nurses delivered care virtually between 2019 and 2020. So the pie chart on the left shows that we still have a big chunk of clinicians that are falling behind in terms of virtual care delivery. But the good news is primary care physicians communicating with patients via email and using remote patient monitoring are both trending upward. And we have almost the same scenario for nurses. Our recent survey of Canadian nurses revealed that nurses are increasingly delivering care virtually. Next, please. Now, let's jump into the findings of the analysis. Just to give you a brief overview of the process that generated these estimates. Number one, we estimated average virtual care visits conducted through video and email from the survey sample. Number two, the average values are extrapolated to the general Canadian population using StatScan population data. Number three, we generate the CO2 emission savings from the extrapolated numbers. Now, this bar chart shows the average video visit and secure email consultations conducted by respondents in 2019. We did the estimation for rural and urban areas and for the survey sample. Overall, on average, the number of visits conducted through secure email, 2.4, is greater than the number of visits conducted through video conference, 1.6, which is consistent with the findings from the recent nurses survey, where we found that nurses delivering care virtually were more likely to use secure email compared to other virtual care tools, regardless of their main care setting. Next, please. Now, for distance travel, we estimated both the average distance traveled by patients to see their regular doctor or place of care, the blue bar, and the average travel distance to the closest hospital. And overall, on average, patients travel 18 kilometers to see their regular doc. And as you can see, there is the average distance to visit regular place of care is greater than the average distance to closest hospital. I'm not going to debate why we have this difference. Next, please. We were also interested in estimating the average in-person visits. On average, Canadian patients conducted 4.5 in-person visits in 2019. And here we are talking about primary care visits. Next, please. Okay, now for the extrapolation. So for the volume of care visits and in-person visit, on the left-hand side, we have the numbers for the sample, for the overall sample, and on the right-hand side, we have the numbers extrapolated to the Canadian population. And for the extrapolated numbers, we can see a big gap between volume of in-person visits and virtual care visits. The extrapolated volume of virtual care visits conducted by Canadians, all other things remain the same, hover around 5.8 million, both video and secure email. Next, please. The 5.8 million for virtual care visits represent 4% of the total of primary care visits. Of this percentage, 25% are video visits and the remaining 75% are secure email visits. So the total amount of carbon savings associated with this estimated 5.8 million virtual visits is 23.5 metric tons. Now, let's pause for a second. Virtual care visits account for roughly 4% of total primary care visits. Let's imagine that the share was bigger, say 10% or 50%. This is exactly the purpose of the next slide. Next, please. So this table shows the projected volume of virtual care visits along with the associated carbon savings for different scenarios. For example, if the share of virtual care visits in overall primary care visits reaches 50%, Canadians will enjoy a carbon savings of 325,000 metric tons. Next, please. This significant amount of carbon savings avoided is equivalent to, next, can I get a click? 70,000 passenger vehicles off the road for 1 year. Another click, please. Enough to power more than 50,000 homes electricity used for 1 year. Just the last click. And is equivalent to carbon sequestered by 5.4 million tree seedlings grown for 10 years. Next, please. Now, the slides that I've just presented concerned what happened prior to COVID-19 pandemic. What I'm about to present now is the current virtual care landscape. Next, please. Starting with COVID-related visits. What I'd like to highlight here is that COVID-19 has accelerated the use of virtual care. As you can see from the chart on the right, by the end of April 2020, roughly a month after the World Health Organization declared COVID-19 as a pandemic, approximately 60% of COVID-19 related visits were conducted virtually, with telephone consultations making up the bulk of these virtual visits. And in May, while most Canadians still relied on in-person visits for COVID-related concerns, almost half consulted with their docs through telephone, video conference, and secure email. Next, please. Now, for routine visits, we have almost the same scenario. So consumer adoption has skyrocketed. The majority of the visits are conducted virtually. Now, it is interesting to note that we are already at the projected 50% of primary care visits being virtual. Next, and just to show you that reaching the 50% level is achievable, next, please. Just to show you that reaching this level, the 50%, is achievable. So between 2019 and 2014 and 2015, at Kaiser Permanente, 52% of the physician member interactions took place via smartphone, video conferencing, and other virtual tools. Next, please. And in July, August 2020, we will have our next annual tracking survey. So we will have updated stats on the uptake of virtual care in Canada, and we will have a deeper dive into the uptake of virtual care services by Canadians. So keep an eye out for it. Next, please. Now, it is worth mentioning that our analysis did not estimate the environmental costs associated with virtual care. For example, electricity use, carbon footprint of equipment, but the overall impact is still expected to be net positive. Next, please. Now, in conclusion, virtual care and telehealth are actually potent carbon reduction strategies for the healthcare sector. So with the rapid consumer adoption due to COVID-19 pandemic, we have lots of opportunities to make the Canadian healthcare system environmentally sustainable. Thanks, and over to you, Simon, for the questions.
Thanks very much, Waldo. Really great presentation, folks. Really appreciate that, and I can tell from the webinar chat we've got going on that lots of people really appreciate it as well. So thank you. The first question that came up time and time again is, will we be sharing these materials? And the answer is yes, we will. We will share the materials. We'll be able to post this webinar and the slide deck, and I think it's fair to say that both of our organizations have a fair amount of material available, both publications and other materials on our website. So we would absolutely encourage some of that for folks to have a look around and reach out to us. We have got a lot of questions, which is great and not surprising since we had over 300 people on this call, which I'm very excited about. We don't usually see that many people. So I've bundled them together, and I'm going to try and get through some of the most important ones, but please keep in mind that we do have a list of them, and we'll do our best to get back to you if we don't get to your question on the call. So the first couple of questions, maybe I'll give to you, Nicole. There was a couple of questions that related to the scope of what was in some of your work. So a couple of things that they were curious if they included. Some of the cost of electricity generation relating to the video bandwidth that's required, relating to the energy that's required to run EMRs and the internet. And then the other piece was other pollutants beyond CO2. So I wonder if you want to have comments on any of those topics in terms of, are they in scope of the analysis that you've been working on?
Yeah, so I should say that we are starting to undertake this work. And so what we've been doing thus far is trying to get a sense of the work that has been done in this area. And the question of how we draw those system boundaries, this is really pertinent here, because when we think about the electricity used, what is measured is the use of those individual pieces of technology. So the screen, the phone, we could certainly draw the boundaries much larger than that in thinking about all of the different emissions associated with those technologies. But for the studies that we've looked at, it's only associated with the use of those objects at that time and for a given duration. So most assume a 1 hour long appointment. And most also find that virtual care visits end up being shorter. I don't know, maybe this is something that you can speak to as well. So certainly where we draw those system boundaries as we move forward with this work and we think about actually undertaking these kinds of studies in Canada, in the Canadian context, hopefully with some of the great work that you have done at Infoway and in partnership with other health facilities, we definitely need to think about that. In terms of the second question about other kinds of pollutants, I did focus on carbon here. That is sort of where the bulk of the focus is within this literature, but several studies do also address other kinds of emissions, particulate matter, sulfur dioxide, nitrogen oxide, and with all of these other kinds of emissions, there is an observed reduction. And so again, that's not getting at the pollutants that are involved when these devices are created, when they're distributed, when they're disposed of, which is a huge issue that perhaps we do need to think about including in future analyses. But there is some attention to this in the literature, and I'm very happy to put anyone, sort of connect them with papers that address this particular issue. If they're interested, please just contact me.
Fantastic. Thanks, Nicole. So the next question I'll direct over to Waldo and Bobby, and you guys can fight over it. So a couple of questions that relate to the broader value proposition. So obviously we focus this discussion heavily on the environmental aspects, but questions about, are we looking at things like financial sustainability, like avoidance of visits? So comments about the sort of broader value proposition for virtual care.
So maybe I can jump in, and Waldo, feel free as well. For sure. I mean, there's only so much we can cover in 1 hour. This is a very broad topic. As far as the benefits that have already been quantified and discussed, I would point people to the telehealth study that we did in 2011 that I mentioned, as well as a follow-up study that focused on telehome care or remote patient monitoring. You can find both of those on our website, where a lot of benefits, both in terms of improved outcomes, reduced hospitalizations, reduced ER visits, especially from things like telehome care, where patients are monitored from their home, and you know, the interventions can be made sooner. As far as virtual primary care, that is still a work in progress in terms of understanding the impact on, you know, longer term outcomes. One of the directions we're moving to is to really understand where virtual care is a substitute for in-person care, or if it's something that is it not directly comparable. So will people have improved access, for example, more timely access as a result of virtual care? Will certain consultations that are pretty straightforward, can those be taken care of through virtual means, allowing in-person care to focus on more complex issues? Those are all things that certainly we need to study further, but definitely in terms of access to care in terms of timeliness of care, we've shown how virtual technologies can assist.
Great, thanks, Bobby. And so, yeah, those comments were really helpful and actually touch upon quite a substantive thread that's been going on the chat. I think actually it's kind of nice to see that the chat section on this webinar, and everybody, I think everybody can see some of those, but maybe not all of the comments on the chat, but a really in-depth discussion around this topic of appropriateness of care. So in what context, for what patients, and with what tools is virtual care appropriate? You know, I don't think that those of us that are panelists on this webinar have the definitive answers for that, but I was really pleased to see some of the discussion thread going on amongst participants and the sharing around that. And if we can encourage that sharing or support that sharing, I know we at Envoy are really keen to do that. But maybe since that topic was such an important one, I'll open that up to the panelists, any of them that want to sort of comment on how we will be advancing our understanding of appropriateness of care or care models, if there's anybody that has a comment on that.
I guess I'll just quickly say that certainly ensuring that virtual care is having a positive impact on health outcomes is part of what will make it key to a sustainable health system. Because if it produces negative health outcomes that necessitate further care, then it's really defeating the purpose with respect to sustainability, because the further care that's required is going to involve emissions, carbon emissions, and other kinds of emissions, and we really don't want to see that. So it's very important that we see virtual care with positive health outcomes. So we would never advocate for virtual care only because it's more environmentally sustainable. In the absence of positive health outcomes, it isn't.
Right.
And just to add to that, you know, the current environment is providing a great test case and an opportunity to really examine these different modalities and the way healthcare is delivered. One of the comments, or a few of the comments that I saw, was around integration with EMR systems, and that is something that we're definitely focused on to have, you know, virtual care not just as a medium of communication, but integrating it into the way that healthcare is delivered. Also to allow care providers to choose the most appropriate type of modality, given the treatment necessary, given the conditions of the patients, given the types of patients that they are seeing. So working on that integration, working on making tools that are integrated with clinician workflow is going to be key to long-term success.
That's great, and very consistent with the chat as well. And we saw a number of comments that related to, you know, that integration, both technically but also within the circle of care, as well as the need to think about more specialized tools like blood pressure monitors and things like that, and how those integrate into new models of care. So really important discussion. Nicole, you touched really on an important topic of health outcomes, which we had a couple of questions on. We don't have definitive answers on health outcomes. Obviously, at this point in time, it's a large question, but the thing that I was excited about with the group of folks that have joined this webinar is there's lots of folks in Canada that are looking at this question. And so hopefully we can all be part of doing research that advances that question. We've got 1 minute left and probably not time to respond to a full question, but I did want to make a shout out to a question that related to clinician experience and the fact that moving to a virtual world is absolutely challenging from a clinician perspective in terms of managing the technology at the same time as managing that patient care. Again, an area that we at Info have not done extensive research. I know there's some research going on out there, but I want to flag that that's front and center and a really critically important thing for us. The clock has ticked to 1 o'clock. I want to thank all of you for a really incredible, very interesting discussion. And I want to thank everybody for joining us today. We're very pleased to have so many people interested in it. And we hope we've started a discussion that we hope will continue on for quite some time as we evolve the use of virtual care in Canada and evolve the sustainability of it from an environmental perspective. Thanks so much, and we'll see you all again soon.